here. I'm gonna say, I'm gonna lift your feet up. Thank you. And down, nice and easy. Now, I suggest bring the sheet up at least kind of over the neck and shoulder area, okay? Make sure this isn't tight. You could put it all the way over the head, but you don't necessarily have to. Okay, now, I am going to suggest a specific orientation because I want to work on the right side last. So I'm going to instruct the client to turn on. I use tactile things with this. I'll say turn on your right side with this side up. Because it's real easy once you're a massage brain to just not know your directions anymore. So this side down, this side up. See how it's not lifted high, just held across. Okay, go ahead, turn. Wow. Now my client is amazing. She scooted down off of the face cradle. Maybe just a little bit further down, all right, please. And she's already far enough back to where I can be contacting this area while standing at the side of the table and not be reaching. So I usually have to tell a person to,
sorry.
You're doing great. No sorries. And then head up. Lovely. So that pillow that was underneath the abdomen comes up here. Consider if a person is broader shouldered, or if they seem real kind of crunched in on themselves, use this. Use your face cradle underneath. Is that any more comfortable?
Yeah, it is actually.
And it's nice and flat, has a divot in it, so it'll hold it nice and stable. Then get this out of the way. Move it out of the way. Either fold it down, get it completely out of your way, so it's something you don't have to navigate and worry about. Okay, kick things as you need to. Big square bolster, kick things as you need to. Gotta have these. I gotta make more. Okay, this is where the second sheet is hugely helpful because I can just take this completely up and over, this down, and I can help guide, but that's the top leg. You want the foot and knee on this. You don't want the foot hanging off the edge. So I might have to adjust it just a touch. Okay. You go ahead and, would you like a pillow to hug here in the front?
I'm okay.
Okay. If you're seeming to roll too much on you, go and bring that in. This is my tactic. I know we've covered other ways to drape around the head and neck, but this is the one that just makes my life so much easier. Covers the chest, helps me with so many things here. So it didn't matter, male, female. If they didn't already have the blanket on, I always put this towel over them on their side. And I'll adjust that as I need to, okay? All right, now she said she likes like the neck work, so I'm gonna focus my attention a little bit there. Is there my hand placement and body mechanics can be a little bit stranger. This is why I save my hands with the rest of the massage, just so I can be a little bit more specific here. I'm feeling around the temporalis muscles, then there's frontalis and occipitals. Think of these muscles as essentially controlling the scalp. And who wants a hat that's too tight, right? So moving these muscles and creating, I think of the scalp as being pulled too taut. So if I approximate and pull the muscles towards the crown, everything up towards the crown, I feel like I'm giving the scalp some more freedom. See how I'm pulling everything up? Eyebrows even, it can be a frown, but usually it feels better. Up. Here I don't want the neck to be going back and forth too much, so that's what mostly the stabilizing hand is doing, is holding the head still while I just pull. You can make these pretty big. It just looks like a terrible time, right? Be inventive. You know, rather than this kind of more targeted approach, which you can use. Like I could use this around temporalis and masseter if it was jaw pain. But for relaxation methods, I'm just trying to do a really nice, thorough head squish and making the scalp move as much as possible. Now this hand on the occipitals, it's putting a fair amount of pressure on the back of the skull. Looking at muscle charts, you'll see that. Frontalis and occipitals sometimes are put together as one muscle called occipitofrontalis, thinking of the scalp as a shared tendon between the two. So if you see in your books, we separate it as occipitals and frontalis, but it might be occipitofrontalis in other texts, or if you look it up online. Now the neck work stuff, I'm going to not talk too much about it. It's just going to be demonstration time so that I'm moving along a little bit. Here, I can grab and open the space of the neck up so I can just get my hand here. So I'm just holding the scapula and trap. I'm holding the scapula down, lengthening the trapezius so I can get my palm here. The goal with all of this is just to make sure you don't go too far anterior. Look at the, you want to have the shoulder set in such a way where it's lined up with the ear, and I don't want to go anterior to the ear. Everything else though should be safe and good. So my hand is contacting, just holding the head so I know where it is, getting my forearm placed, and I can do 2 for 1, holding the shoulder, a little resting on the head. That way I know where the shoulder and the scapula is. I know where the head is. And then I start figuring out my applications. Pulling the traps. I'm working on upper trapezius right now. Okay. Pressure. Cross. Cross. And this isn't the bad one, right? This isn't the elevated side, so I'm going to spend a little bit less time here. And work my way up the neck. So I'm showing using a forearm on the cervical area. I'm on the lower half of the cervical related muscles. There's a bunch here that is not worth me hurting your brains with quite yet. So, but there's a lot of muscles in the neck. And I work my way up just the slightest bit, more near the occipital base. All with a forearm. Had to relax my hand a bit there, see? Palm down, not thumb up. Now that massaged the neck muscles kind of down and across, right? Now I'm going to shift it. This is usually a crowd favorite, but I want you to know that I'm contacting the upper traps, just letting it guide me, not trying to like press and work on the upper traps right now. I'm just making contact so that it guides me to the neck. Then I can just follow that up to the base of the skull. But it feels like a nice long swoopy glide because I make contact with the skin of the traps. Down, then up. There's the base of the skull. And I adjust my positioning and pressure. Tell me when I find just the right pressure. Good. Now, is that intense or does it feel good?
That's good.
Okay. Sometimes these can be very intense, okay? Now, a good starting point for working that structures the base of the skull. There's a lot there, you know, upper trapezius, and even the more superficial muscles start there, but then you go deeper and deeper to the sub-occipitals. So there's sub underneath the occipital bone. Eye movements eye movements are a great way to send activation signals, like on and off signals to those muscles. So eyes closed, just roll your eyes in big slow circles. And I can just work anywhere through this area. I'm kind of just rocking a little bit back and forth, finding a spot closer to the spine, finding a spot closer to the ear. And switch direction with your eyes if you haven't. And good. And done.
Holy Anna Barbara.
The benefit of a forearm here, I can't begin to tell you how much that is just the best tool you will ever have for tension headache. But it's a broad-based compression that allows you to cover more of those structures at once, and because it's a broad base, it's way safer. It feels way better. You just have to just position your arm, see how my elbow is flexed so that I'm not falling too far forward. That's all it really comes down to. Okay, now here, what I need to do is have you bring that arm out and over. How I control that, I ask the client to do it for me. I gotta grab a towel. This is gonna come over top of that arm, go across the neck and chest, and that's how I actually do it. We show you all the options, but that's how I work here. Now, the lateral side of the torso. This is, I'm just gonna show how I actually do it, and it might drive you crazy. If you have to, just rest their arm down on top of yours. You can bring the arm up over their head. It's just initially for you, you're gonna have challenges not being too much on the scapula. So bringing the arm down moves the scapula out of the way. It retracts it so you can get onto the ribs. The specific muscle there is serratus anterior. The other big muscle here that's further back and rides right on the line of the scapula is latissimus dorsi. To be on those, though, I have to start really close to the arm, up in the armpit. In order to make it more comfortable, this is my thing. I'm here. I just actually let my wrist not be relaxed this time. The arm right there. Then this hand can come over and help control where the shoulder is. Sometimes this works good for people. Sometimes you may find that this just doesn't work, especially if the proportions are crazy, like they're really small or they're really big. It might make it less comfortable. Now here, latissimus dorsi has some mass. There's other ways for me to work on that if I wanted to, like in supine and even in prone. Right here, I'm going to worry more about serratus anterior, and talking about stress management, I'm going to think more about breathing. Okay, so let's worry less for the moment about specific muscles. I'm thinking about just applying compression on the whole, as much of the ribs as possible, nudging them down into an exhalated state, and I'm holding the scapula down. And I say just good deep breaths. Big, big inhale, and good long exhale. And with the exhale, I just try to follow the ribs in if I can, and when she inhales, I try to not let her push me out. Okay, another one. And that might be all I do here. Go forward, wherever's comfortable. I'm going to go after the low back a little bit. There's a lot here. If I go more anterior, I'm going to be on the obliques. Deeper to those, so there's two obliques, external oblique, internal oblique. Deeper to that is transverse abdominis. Deeper to that, connecting the top of your iliac crest to the side, the lateral side of the lumbar vertebrae, and the last rib, the last floating rib, is that quadratus lumborum muscle. Quadratus lumborum, or QL. So a lot of times if you see this demonstrated, this orientation of coming down the side of the body, they'll call it a QL release, or a quadratus lumborum release. Pressure. And Is that,
It was-
I
that was
see
good.
flinchy eyes,
Like the
but
flinch, I was like, almost,
Yeah, well.
almost gonna say no at that point, but I was like right there.
now, this muscle attaches onto the ribs. What could I use? Breath. Big breaths. So I'm on the side of the body. What can I use? Breath. I'm up at the base of the skull. Eyes. Start there. We'll make it more complex. Good. There was a deeper exhale. Take your victory and run. Don't spend too long. Now I changed my orientation, so now I'm more posterior. Now I'm thinking the lumbar, dorsal, fascia, or even the erector spinae muscles like by the spine. How are you doing there?
Good.
Okay. Now for this one, just to give you something that you can do here, and it would work for all areas, I can ask the client to just start, smallest activation is needed. Just start to lift your bottom leg up off the table. Tiny, tiny. Good. Hold it. And let go. That'll accomplish a contract, relax. And lift. What I like about doing it this way, I don't have to change the bolster, and the movement and down isn't putting any stress on the spine. Good. Moving along. Come down. The lower leg. My time management isn't great. This is going to be a 90-minute session.
Oh no.
So hard to be a massage demo. All right. I applied lotion too fast. I'm using the backs of my hands to confirm if there's any hot or cold areas. That's where trying not to rush, but like managing your time is so difficult, right? A couple of knees, working my way down. All knees, working on the calf. I end up feeling like this feels so much better than working on the legs in prone. As the client, I think it feels so much better. Regardless of it being more effective, it's just, you're not hitting the bone as much, you're hitting more of the muscles, it's great. The trick ultimately is finding a way to make sure your arm is oriented so it feels safe. You know, the draping is good, and my forearm is going to be working on the upper thigh. Hand resting just on their body. I'm having to remember what side of the body I'm on. This is not the knee that I'm worried about. So in general, my forearm is placed like this. I'm going across. My application is a bit more posterior. I'm thinking hamstrings. If I flatten out and usually go on an angle, I'm thinking more the adductors. So if you see here, you'll see it on the other side better. Hamstrings, adductors. Hamstrings, adductors. And then hamstrings and adductors. That was all with my right forearm. Now I switch. I'm holding the lower leg, holding the tibia so it doesn't move out of the way. And then I'm going right across gastrocnemius. Remember, I got the lateral side of it in prone. Now I can get the medial side of it in sideline. You'll see this better when I turn the other side. There's that. This is also a place where those structures I talked about that are underneath the Achilles-related muscles. A soft fist works really good. And I just stay very medial. I want to be right here, trying to be behind the tibia. So I'm trying to pull, trying to bend the muscles that become the Achilles away, smush them into the table, so that I can get some pressure on those structures underneath. And with this, what the client had wanted was a deeper pressure, like more aggressive style, deep tissue style massage in the feet. And that tells me, well, you know, muscles that go into the arch of the foot might be important. And they live back here under the Achilles. Oh, is that a flinch?
Yeah, just a little bit. That's where a lot of pain comes. Like, I don't feel it when I'm walking. I just feel it when it's getting work done. I don't know. It's good. The good or hurt.
But check in, you know, that it's a good thing. I can bring in some pin and stretch methods where I can take those structures, preemptively shorten them, apply compression to the structure, and then once I have my compression set, lengthen the structures under my contact. That'd be a pin and stretch.
I have a question.
Mm-hmm.
Is there a way to tell that if somebody falls asleep on the table and you're trying to like
The sleep twitch versus
versus like a twitch that
over time, it still scares me. They'll do like this big twitch, and I'm like,
usually you can look at them and they're like,
yeah.
like,
Usually I go, is that a flinch? And if they don't say anything,
Yep.
you're good.
but yeah, starting out the sleep twitch, yeah, it'll terrify you.
My husband, he'll fall asleep on the table and he has RLS. So like,
Oh, of course. Yeah,
twitch, and I'm just like, oh my gosh.
Yeah.
Okay.
There's also
Exactly.
people that just cannot accept their body does not respond to passive movement. If anybody's had that client where you try to passively move their knee back and forth and you can't, and you just do the best you can. But yeah, you get usually used to, in this case, a client with restless leg, then you just have to kind of have yourself ready for that. But it's a good question. I don't have a good one for the sleep twitch.
It's okay.
It's great to find out that it's that versus
Yeah,
a pain
right.
twitch, right? So forearm. Well, I do a lot of across the arch. If I'm visualizing the foot, I'm going perpendicular to the arch, and then on an angle more parallel to it. But you can do some great work here, and you can get pretty pointed with the feet. The feet can tolerate a lot of pressure. All that should be good. I hear nothing bad. My non-working hand, in this case I'm using my right forearm. My left hand is cradling the foot. So I'm just being extra thorough. The things I want to watch out for is not direct pressure on the end of the first metatarsal, which is what we call the ball of the foot, the joint where the big toe starts. That you have to be careful of. It's just two little tiny bones and some tendons, so you don't want to push on that. Everything else, though, is pretty much fair game.
So when you're focusing on an area and you're doing that, like for instance her feet, that she's having more pain in her feet, you're just doing the same kind of movements, just repeated a couple more times than
Yep.
you would on the other parts of the
And
body.
slowing down and trying to target, once your anatomy comes more in, then what I'm thinking is about all the structures there, and as I'm doing these applications, each one is targeting more specifically those structures.
Right.
So in this case, I know that was the ankle, right?
Yep.
Okay. This isn't the ankle. This one will be more important for the other foot. For here, let's say it's an issue with the foot and or the shins. If there's no issues here, I can think more generally. Think about just the compartments. There's an anterior compartment that's all about toe extension and dorsiflexion. Then there's a lateral compartment on your fibula called the fibularis muscles and the peroneal muscles. Those are everters. That's eversion, inversion. Eversion, inversion. If there was an issue here, I would think about every single one of those little muscles and try to do an application that's like for every single one of them, right? It's kind of a generic answer, but
Yeah.
if it's something more relaxation based, then I think let's just get all of those. Kneading here works so good. It's one of my favorite parts because I can, there's the tibia right here, then all the muscles start. Then my pole hand can be grabbing a hold of all the gastroc and soleus, those Achilles muscles, and giving those a pull, while these are getting a push. Works really good. Now I'm showing with hands. I usually use this as more of the light superficial part. I'm finding a little bit of something. My hand underneath can curl, so I can use finger point pressure to go underneath the Achilles as well. But I can also use a forearm here. This is what I actually usually do. Forearm for the anterior group. Now, the lateral group. It will look just like the hamstrings and adductors. All right, tibialis anterior, extensor digitorum longus, extensor hallucis longus, fibularis longus. It's apparently more about fibularis longus.
Yeah.
You see, that's the assessment. I'm doing massage, but I'm feeling for things that jump out, and I'm also getting the client's feedback. And now I can go, okay, the knee and ankle stuff seems to be more about this fibularis group and that deep flexor group. So that's in the future, I'd make sure I chart that so that when she comes back for her next session, I know how to more specifically go after these structures and not be just searching. But that first session, the first few sessions are assessment, and really the assessment never stops. Because after a while I want to be asking myself, is this improving or is it not? Okay, hand underneath with curled fingers, hand on top. This is where this hand underneath, I can really get pointed if I need to for a client that wants more aggressive pressure. All good?
Yeah.
Okay. In a teaching orientation, I just want to make sure I'm not paying attention.
Not doing great.
Shear. Gah. Get those metatarsals moving. That's where the muscles that open and like spread, abduct, and adduct the toes are. So bunions, stuff like that, that's where I would work. I wouldn't worry about where it's crossing over. I would just try to keep the structures between the metatarsals free. All right.